Welcome to the 5th Annual Jewel of the Stillwater. We are excited to gather with you, our friends and supporters of the Stillwater Community Healthcare Foundation. We appreciate the opportunity to showcase our organization as we expand our opportunity to perpetuate the delivery of quality health care to our friends, our families, and guests of Stillwater County. The Stillwater Community Healthcare Foundation was established in 2004 and has supported Stillwater Community Hospital, now Stillwater Billings Clinic, by addressing the ever-changing needs of healthcare in our community. The Stillwater Billings Clinic story holds a small-town hospital at its core throughout history. It unfolds the advancements in healthcare throughout time.
I'm Webb Mandeville. When I think about the hospital and the effect that it's had on our community and our quality of life, I think about my family and what Stillwater community means and has meant to us. My dad was born in the old hospital in 1916. I was born in the old hospital in 1949. My boys were born in the old hospital in 1984 and 1986. My dad passed away in the old hospital in 1985, and my mother passed away there in 1994. The hospital is part of these huge life events, but it's much more than dates and events. It's knowing that the hospital is there, and it's when it's your time to be cared for, you'll be cared for by people who know you, know your family, or know of you, and who care for you. It was Rose Blinkner's kind patience and wisdom leading us through my wife's pregnancies and deliveries. It was Bev Cavanda crying with you when you get to the hospital after you get the call that your mom is gone. It's Edith Vig putting together great meals and always being so accommodating and allow us to have our last Christmas dinner at the hospital with my mother. It's David Kane and Rick Klee living here, raising their kids, attending ball games, being part of our community, and being there when you need them. Stillwater Community Hospital is a big part of what makes our community, our county, such a great and unique place to live. I think there's kind of a bedrock basic security that we all enjoy, knowing that we have such a fine medical facility in our community, backed up by the Billings Clinic. It's easy to take for granted what we have until we need it, and then it's really a blessing. I can't think of many communities our size that have what we have.
Stillwater Billings Clinic CEO Tim Russell has been a part of the most dynamic changes for the past 25 years. He has been a catalyst in the process of change from Stillwater Community Hospital to our new campus and organization of Stillwater Billings Clinic. He has seen where we have been and has visions for the future progress moving forward.
Our partnership with Billings Clinic has proven to be very beneficial over the last 4 or 5 months that we've been open. The integrated campus is really bringing value to us, not only here in Columbus, but also through the patient care stream into Billings. But really what it is making sure that as your local provider, Stillwater Billings Clinic is here to serve us today, service long into the future. We had an opportunity to have our old facility for 50 years. We hope to have this one here serving the community for another 50 years going forward. But we want to do it with that patient-centric method in mind and make sure that you have your care delivered here. It's part of who we are, and we hope to stay part of your community for a long time.
Stillwater Billings Clinic has been a vital component of Stillwater County and impacted our residents and their families. The foundation serves as a vehicle for meeting the healthcare needs in Stillwater County for our friends, families, neighbors, and guests. The imperative growth of the foundation is demonstrated through the impact of our residents having access to healthcare in the rural communities of Stillwater County. Bharat and Linda Acharya of Columbus have firsthand experience in the critical need for our local hospital and are very grateful to the staff and physicians of Stillwater Billings Clinic.
My name is Bharat Acharya, and I've lived in Columbus community for just over 25 years now. And I think it was about 8 or 10 years ago I had a couple friends at my home and asked them to help me stack hay. And it happened to be a day when it was 101 degrees out there. And I must have thrown maybe a dozen bales in, stacked them, and all of a sudden I started feeling this breath. I was out of breath, and it was not the type that you get from exerting yourself, playing sports. It just was different, and I knew something was not right. So I had the friend call 911, and emergency vehicles arrived within 5 minutes of the call, and I was wheeled off to the hospital. And as soon as I got to the hospital, the nurses went immediately to work to stabilize me, and it just so happened that Dr. David Kane was the doctor on call that afternoon, and he's a personal friend of mine and also my physician, and I felt very secure that he was the one who was going to take care of me on that given afternoon. And between him and the staff, they went to work and had me stabilized in the hospital in about 45 minutes. And during that time, he was communicating with the cardiologist in Billings over my EKG and what he should be looking for and so on and so forth. But after that first 45 minutes, I was sent on to Billings to be taken care of by a cardiologist. But as a person who lives in Stillwater County, I feel really fortunate that we have a facility like the Stillwater County Hospital that allowed me to get immediate attention for my problems rather than having to be sent by ambulance or by helicopter to Billings, which would have taken the extra 45 minutes maybe. So I feel really lucky that I was taken care of right away, and within the next 2 days I was totally taken care of in Billings, and I'm back with my new heart now, and it works like a champ.
Brat's story is a great example of the importance of communication between our local providers and our partners at Billings Clinic. Today, with our electronic medical record, it's important to note that our communication is streamlined even that much more. It's almost instantaneous. The Stillwater Community Healthcare Foundation today is that foundation for us in moving forward to help ensure that we do have quality care long into the future. Representing the foundation, I'd like to introduce Dick Henry.
As a member of the Stillwater Community Healthcare Foundation Board, I've seen some changes on that, and I have been involved in some of the changes. And I sincerely want to thank all of the people who have been so generously in helping us out, especially the business people, the organizations, companies, and very strongly the individuals on there for their very generously support on there. For without them and all you folks supporting us, we would not have been able to probably get the state-of-the-art facility and the state-of-the-art equipment that we have now to offer to the services of our families, our friends, and our neighbors on there.
Again, we'd like to thank everybody for coming and spending the night with this year's Jewel. From all of us to all of you, we'd like to say thank you. Give a thanks to all of our corporate sponsors: Montana Silversmiths, Columbus Health Mart Pharmacy, Stillwater Mining Company, Billings Clinic, Parks Real Estate, Yellowstone Bank, Yellowstone County Implement, Columbus Ace Hardware. We'd also like to thank our table sponsors: Dr. David Kane, Dr. Rick Lee, Billings Clinic, Kent Brown, Stillwater Lumber, Cavanda Homestead Ranch, United Bank, Montana Real Estate Brokers. A thank you to our Jewel Raffle Montana Gems. And to all of you who so generously donated to the silent and live auctions, we thank you.